HR, just to confirm the provider's orders, it looks like we have an order to place an indwelling catheter on a Maria Hexco, who's 77. I'm just gonna make sure I have gathered all my supplies. I've got a catheter kit, gloves, stuff for hand hygiene, a chucks pad, and wipes. All right, so I'm just gonna perform hand hygiene. Hi, my name is Avery. I'm gonna be your nurse today. Can I verify your name and your date of birth?
Maria Hexco, January 19th, 1946.
Okay, perfect. And Maria, do you have any allergies?
I do not.
Okay, awesome. So today the provider has put in an order to place a catheter. Have you ever had one of those done before?
No.
Okay, so basically I'm going to be inserting a catheter tubing up your urethra. It's going to be able to relieve the pressure on your bladder and just release the urine from your bladder. Is it okay if we do that today?
Yep, that's fine.
Okay, awesome. So I'm just going to raise the bed to a comfortable working height just so it's a little easier. And also take this side rail down. Okay, and then I'm going to help you into a position that's just going to make it easier for me to place the catheter. So I'm just going to lift your legs up on both sides. Is this comfortable for you?
That's great.
Okay, awesome. Thank you. And then I'm going to be placing this chucks pad underneath you, just in case during the procedure there's any urine or other liquid that comes out. And I'm also going to be providing peri-care for you just to clean the area and make sure everything's clean so that when we place the catheter, there's no infection or anything like that. Do you have any questions for me?
Not right now.
Okay, awesome. All right, so I'm going to be placing this chucks pad underneath you. So I'm just going to have you lift your hips up for me. Great, that's perfect, thank you. And I'm going to get these pads. And again, I'm just going to kind of clean that peri area. So first I'm going to wipe away, and then near, and then down the middle. Okay, awesome. And take off my gloves and perform hand hygiene. I'm just going to move these for a moment. I'm going to open this catheter kit. I'm going to place this bag at the bottom of your bed, just by your feet. This is just going to be kind of act as a trash can for me. I'm also going to be placing the catheter kit in between your legs, so just make sure you don't move for me. Okay, and then this is a drape that I'm going to be placing just in between your legs, so make sure not to move for me. I'm going to be placing the shiny side down. This is just going to keep the area sterile. Awesome. Perfect. Making sure not to reach over myself. I'm going to perform hand hygiene, and I'm going to put on these sterile gloves. Now that I'm sterile, I'm just going to be moving these boxes within this sterile area so I can set everything up. So I'm going to open these alcohol sticks, place them in the box here, open this lubrication jelly and pour it in. Okay, and I'm going to be getting this to attach to the bag so that I can pump up the balloon. I'm also going to be checking the bag just to make sure that it is clamped, which it is. I'm going to be taking this off. Okay, and I'm going to put some lubrication jelly on the first couple of inches. Place that back in the box along with the alcohol swabs. And I'm going to put my hands that are sterile inside of the box. And then Maria, I'm going to be placing this in between your legs. Okay. First, I'm going to get these alcohol wipes while my hands are still sterile. Okay, and then I'm going to be using my non-dominant hand. I'm going to be pulling apart after I've already identified the urinary meatus while I was cleaning you. I'm going to clean away and then towards myself and then down the middle as well. Okay, so now I'm going to be grabbing the catheter. I'm going to start inserting it, so I'll have you bear down for me. Okay, I'm starting to see some urine, so I'm going to grab this with my non-dominant hand and keep my sterile hand over here while I insert the fluid. Perfect. I'm going to throw that away. Now I'm going to pull against resistance. I feel the resistance, so I'm going to insert slightly. I'm going to take off my gloves and perform hand hygiene. Okay, and then I'm going to take this bag. First, I'm going to attach this to the inner portion of your leg just to make sure that everything stays secure. Okay, now that that's secure, I'm going to take this bag and I'm going to go underneath your leg, make sure that we're not getting caught on anything. And I'm going to place this on the bed rail. I'm also going to check the urine output level while I'm here. Looks good. And I'm going to perform hand hygiene again. And we're going to do some more peri-care because I placed some of that alcohol wipes on your urinary peri area. I just want to make sure it doesn't agitate you, so I'm just going to put gloves on and kind of clean you there again, okay?
Sounds great.
Okay, so again I'm going to clean away and closer to myself, being careful of the catheter, and down the middle. Okay, I'm going to take off my gloves. I'm going to throw away all my unused items, or all my used items. And then I'm going to perform hand hygiene one more time. And let me help you back into a comfortable position. I'm going to bring this side rail back up, and then I'm going to lower the bed so that we don't have any safety issues. Perfect, it looks like it's lowered all the way. Okay. All right, and then I'm just going to make sure the brakes are on, and then this is your call light right here. Do you know how to use it?
Yeah, I do. Thank
Okay,
you.
perfect. Just press that red light if you need anything. I'm going to go document.